I wonder why Mommy has been telling me to stay out of the basement. She sure has been acting strangely lately. There's that strange noise again. Hello? Is anyone down there? Hello? I'm not afraid. Hello? Anyone? My name is Cindy. Can we be friends? What was that? It came from over here. There's something behind this box. Oh my goodness, it's a baby! Mommy must have had a baby and not told anybody. But why? I always wanted a baby brother. Oh, poor little baby. I'm your big sister. I'll hug you and love you and protect you, and we'll be best friends. Take that! And that, you son of a bitch! I want to live!
Bad pediatric facial traumas are thankfully a rare thing, but when they do happen, you're in a really tough spot because if you can't intubate the patient from their facial trauma, you also can't perform a cricothyroidotomy on them because of their age. In these cases, we hear a lot about doing jet ventilation on kids. And this procedurette is not a comprehensive review of when you should or shouldn't do jet ventilation. It's a complex process and it has a lot of specialized equipment. So if you have this equipment and know where it is and know how to use it, by all means do that. What I'm going to talk about today is ways to quickly jet ventilate someone when you don't have this equipment or no one can find it and everyone's panicking and you have to jet ventilate a child now. The most critical supply for jet ventilation is a large bore catheter that you're going to put in the patient's trachea. You also have to be able to verify placement of this catheter in the trachea by aspirating air bubbles. A lot of people will tell you to use a large bore IV, but if you do that, you got to make sure it's the type of IV you can attach a syringe to. This one you can't. Also, a lot of IV catheters are short and flimsy and will kink really easily and will not work well for jet ventilation. One good place to try is your friendly neighborhood Cordis kit because you always know where they are. And in this kit you have a couple of options. One is an 18 gauge lumen, nice long angiocath with a syringe that you can attach to it. And here we are putting that same catheter into Cindy's adorable little trachea. There are also reports of people using the dilator from a Cordis kit to ventilate a patient. This you would put in using the Seldinger technique, and as you can see, the dilator has an 18 gauge lumen and it doesn't kink. And it certainly is plenty long enough. You would definitely want someone holding this at the appropriate depth. Okay, that takes care of the catheter for the trachea. The other thing you have to have for jet ventilation is a high flow oxygen delivery system. If you don't have a dedicated jet ventilation machine, you can connect an ambubag to your catheter using the Lure lock. There's two ways to do it. One way is to take a 3cc syringe and put in an ET tube adapter in one end once you've taken the plunger out. Here I'm using a 7.0 ET tube adapter. It may depend on the manufacturers of the syringe, so you might want to look into this first. Then you screw the syringe to the hub of the catheter that's in the patient's trachea in the real world, and you connect your ambubag to the other end. And using both hands, you can generate enough pressure to jet ventilate this patient. It's not easy, but it works. This is the part where I remind everyone again that this procedurette is just going over equipment workarounds for jet ventilation and is not a comprehensive review of the rest of the procedure in any way. An alternative technique for connecting your oxygen supply is to just remove the plunger from a 10 cc syringe, insert an ET tube into the back, and inflate the cuff. And you get a very tight seal between the ET tube and the 10 cc syringe. Then, just as before, you connect the front end of your syringe to the catheter that's in the patient, and just connect the rest of the ET tube to your ambu bag, and then begin forcefully oxygenating that patient using both hands. And this should really buy you some time to hopefully pull little Cindy out of this bad situation so maybe she can go get some payback.